everyone. You're welcome to Farm Habitats How discussion. Please, if it is your first time here, give us thumbs up, do something, let us know you are here, and please do not deny anyone you know of this video because it's very important, full of handful of information. Please share on all your social media platforms. So with me today is pharmacist Donatus, the CEO of Smartados Pharmacy. And for those of you who know him somehow, his other name is equally Smart, and you will know the reason why he goes by that name, Smart. And I'm simply Juliet Chinello, pharmacist as well, and the founder of PharmaBita. So we'll be bringing you this every week, how discussion, and we see how that goes, and we'll then know if we'll start doing it twice a week. But the whole essence of this is to give the right health information out there, because if you look at the social media, you will see people that don't even have a background of biology, let alone pharmacology and all that, talking about medicine, health, and giving a whole lot of misleading information out there. So join us. Today we'll be talking about diabetes. So if you know anyone that have diabetes, share this video. And the question we'll be answering is for you to know if diabetes, like the claims out there, if you can cure diabetes finally, and if there is anything you can do to go on remission, and also the issues surrounding non-compliance. What I mean by non-compliance is that some people just wake up one morning and decide to throw away their medication, their diabetes medication, and start taking herbals or things that people claim takes care of diabetes. I have seen one online recently. Someone said, plug on ripe pawpaw, that's carica papaya, boil it and drink one shot 3 times a day and all that. So we are going to address all that. You are welcome, pharmacist Donatus.
Thank you very much for having me, PharmaBita.
Okay. So could you please give our viewers a quick overview, definition of what diabetes mellitus is in a layman's way so that they can understand?
Okay, thank you very much. Sometimes it is very necessary to come down to the kind of language that everybody will be able to understand. But then don't worry, whenever I use some high sounding word, I will try as much as possible to still break it down so that at least everybody will be able to understand the point that I am trying to make. So when we talk about diabetes mellitus, so many things comes to mind. But the fact is that diabetes mellitus is a metabolic disorder that is characterized by hyperglycemia. I will explain. When there is high level of sugar in the blood, we say that the individual has diabetes mellitus. And this high level of sugar or glucose in the blood is either caused by insulin defect or defect in insulin production or defect in insulin action. So either there is a problem with the production of insulin or there's a problem with the action of insulin. Now, the word is insulin. Someone will ask, what do I mean by the word insulin? So insulin is that substance in the body that helps the body to process glucose or sugar. You know, when we eat anything that contains sugar, like the carbohydrates are broken down into the body, and the final product, the end product, is what we call sugar or glucose. And this sugar finds its way to the blood of the individual. Then from the blood, the sugar needs to be transported to the body cells where it is used for production of energy. So all the energy we have to do whatever we do is derived from glucose or from sugar. And this sugar must find its way from the blood to the cells. What ensures that the sugar moves from the blood to the cell is insulin. And the insulin is produced in the part of the body called the pancreas. So if for any reason the body fails to produce this insulin, it means that there will be accumulation of this glucose in the blood. They won't find their way into the cells where they will be used to produce energy. So if there is increased level in the blood, we say that the person has diabetes. Another way, if the body produces enough insulin, there's actually enough insulin in the body, but for one reason or the other, the body does no longer respond to the insulin that it produces. There is no response. We call it lack of or loss of sensitivity to insulin. If that happens, the same thing will happen. There will be accumulation of glucose or sugar level in the blood, causing diabetes mellitus. So finally, in this definition, I would like to add that this issue of increase in blood sugar or blood glucose causes a complete mess up of glucose, fat, and protein metabolism in the body. Thank you very much.
Thank you for that handful, Donatus. So that brings us to next question. You know, when it comes to diabetes, we have different types. Can you throw more light on type 1, type 2, and the gestational diabetes, which often happen in pregnancy?
Okay, in other words, you are talking about the different types of diabetes mellitus.
Yeah, yes.
Okay. Actually, in the real sense of it, there are so many different types and subtypes of diabetes mellitus. But for convenience and for the sake of the people who may be viewing, we're going to narrow it down to what we call the type 1 and the type 2. There are other subtypes, many of which I might not bother going deep into them here. Now, we are looking at type 1 diabetes mellitus and type 2 diabetes mellitus. Formerly, type 1 was called insulin-dependent diabetes mellitus. That was then, no longer now. And type 2 was called non-insulin-dependent diabetes mellitus. I am bringing this insulin and non-insulin so that it will help us to understand clearer what type 1 and type 2 means. In actual sense, there is no great difference between type 1 and there's just a thin line dividing type 1 and type 2 diabetes mellitus. For type 1, it is believed that the people who have type 1 diabetes mellitus have lost the ability to produce insulin. So their body, for some reason, due to maybe autoimmune disorder, by autoimmune disorder, we mean the body fighting itself. There are some certain situations where the body can decide to fight itself. So in that case, we call it an autoimmune situation, or autoimmune disorder. So maybe sometimes due to this autoimmune disorder, the part of the body that produces this insulin is affected, and it reduces the ability of the body to produce insulin. Other things can cause reduction in production of insulin in the body, even infections, environmental factors, chemicals, and so on and so forth. So whatever causes that body to stop producing insulin or to produce insulin that is not enough for the body, then the person will come down with type 1 diabetes mellitus. And type 1 diabetes mellitus is mostly seen earlier in life. So there is early onset, mostly in children, even though it can also be seen in full-grown adults, but mostly in children. One important thing to note in type 1 diabetes is that there is early onset of what we call diabetic ketoacidosis. That is, the people who have type 1 diabetes easily have what we call ketones build up in their system to cause acidosis. As we go on, maybe in the discussion, we will understand this better. They are always not, they're often not that obese. They are always of normal weight, have early onset of ketoacidosis, starts earlier in life, and have lost the ability to produce insulin. That is for type 1. Then almost the direct opposite happens in type 2. In type 2, it starts much earlier in life, even though we have also seen some exceptions of younger people coming down with type 2 diabetes mellitus. And most people who have type 2 diabetes mellitus are obese. You check their body mass index, you will see that they are obese. Most of them are obese, and they don't always easily come down with diabetic ketoacidosis, and their body actually produces insulin, just that it does not respond to the already produced insulin anymore. So insulin is there, but it is not able to send the right signals for the sugar in the blood to be moved into the cells where they are used for production of energy. Then, aside the type 1 and type 2 diabetes mellitus, we also have other types of diabetes mellitus. We have a lot of them, but the most important one that I want to mention now is what we call the gestational diabetes, or increase in blood sugar level seen in pregnancy. Sometimes pregnant women have increased blood sugar level. And if after pregnancy, the increase in blood sugar level persists, we say that the person is now diabetic. Aside that, it just classified as gestational diabetes. That means diabetes that occurs during pregnancy. Thank you.
Okay, thank you for that handful again. So there is another thing I want to ask is there any type of diabetes that is curable, that you can cure permanently and the person will be free from it?
As a matter of fact, diabetes mellitus is not curable. It is not curable. Rather, it is a terminal disease that once confirmed, once diagnosed, an individual will have to manage the situation for life. However, there are cases of people who have been diagnosed of diabetes mellitus, but later, even without treatments, the blood sugar remains normal. Rather than use the word cure, that those people have been cured, we resist that temptation. Rather, we say that those people have entered into what we call remission. So it's possible for someone to be diabetic and enter into remission. Remission means that for some reasons, the blood sugar has remained normal even when the person is not receiving treatment. But later in life, the blood sugar might likely or will likely start coming up again. So if you go ahead and tell such an individual that he or she has been cured, then the individual will no longer pay attention to his or her blood sugar level. So we said such people have gone into remission and will continue or should continue monitoring their blood sugar in case the blood sugar level starts increasing at any point in time. Thank you.
Okay, so do you have any tips on what individuals that have got diabetes can do to go on remission? Tips like diet, just anything they could do to take them, to bring it down for them to be on remission. Yeah.
Definitely, research has shown that one of the most important factors in managing diabetes, and this same factor plays a role in people who are diabetic entering into remission, is body weight. Just as simple as that. As simple as that, body weight. At any given point in time when a diabetic person reduces his or her body weight, the blood sugar level drops on its own. So what really matters here is that In the management of diabetes mellitus, we have the pharmacologic management and we have the non-pharmacologic management. By pharmacologic management, we mean every management that has to do with medications. Then by non-pharmacologic, we mean all those other things that can be done to help control the blood sugar that has nothing to do with medications. And that includes lifestyle modification, that is diet, modification of diet, exercise, and so on and so forth. So in all this, the most important one is weight reduction. So somebody who has type 2 diabetes mellitus, who is obese, working on reducing the weight alone will drop the blood sugar level.
Thank you once more for that. So for those of you that have diabetes type 2, especially you've had it from your pharmacist on what you can do to go into remission. And I think here I might also add maybe avoiding stress, because stress have a way of distorting the whole metabolic system. So if you can cut down on some stress, do that as well. So the fourth question I would like you to throw more light on is the difference in the medication types between diabetes type 1 and diabetes type 2. Different in management approach.
Of course, in type 1 diabetes mellitus, I said earlier that it has to do with reduction in the production of insulin, or even total lack of insulin. So that tells you that the treatment of type 1 diabetes mellitus has to do with insulin. So since the body is no longer producing insulin at all, or is actually producing insulin, but it is not enough, that means that you have to find a way to give insulin from the outside. So that is why those people in their therapy, in their treatment, start insulin quite very early. And the insulin therapy that they are given are divided into three. You have the rapid acting insulin, you have the intermediate acting insulin, you have the long acting insulin. And some of those insulin products are mixed. They are mixed. Sometimes you see long acting and intermediate acting insulin mixed together. But whatever the case, the management is individualized. So everything about it has to be individualized based on the specific need of the patient. But at the end of the day, type 1, people who have type 1 diabetes mellitus will be placed on insulin therapy. Then for type 2 diabetes mellitus, they are mostly managed with oral hypoglycemics. What we call oral hypoglycemics are the medications that are used to manage to reduce blood sugar level. We have so many classes of such medications, and some of them are also managed for obesity, with some medications also that are used for obesity. Some of them are managed for hyperlipidemia. By hyperlipidemia, we mean the high level of bad fat in the system. So some of them are also managed for that, to help in one way or the other to handle the high blood sugar level. Those of them that also have type 2 diabetes mellitus at the same time has hypertension, also managed for the hypertension. Because if you manage hypertension very well, it helps also in the management of the diabetes mellitus. But the most important thing I want to mention here is that even those who have type 2 diabetes mellitus may sometimes still need insulin therapy. That is mostly when their beta function or their beta cells have completely deteriorated. The beta cells are the cells in the body that produce this insulin. So progressively, even those that have type 2 diabetes mellitus progressively have deterioration of the beta cells. So at some point, they might need to be switched from the oral high blood sugar medications to insulin. Sometimes they're given insulin together with this medication. Sometimes they are switched completely to insulin alone. So in conclusion, type 1 diabetes mellitus is insulin. Type 2 diabetes mellitus is oral hypoglycemics or entirely, because there are some hypoglycemics now that are even in injectable form. So let's say hypoglycemics plus, sometimes plus insulin. Thank you very much.
Thank you, too. So the fifth question we are going to be discussing, in fact, this is a question that I've gotten countless times via the My Farm Habitat platform. People often ask, is it true if you are diabetic that along the line, other disease conditions will set in? What I'm trying to refer to is the comorbid diseases associated with diabetes. Is it true that over time you have other diseases to deal with if you do not manage it?
Of course, there's a reason why we are guarding against increased blood sugar. If there is no reason, everybody will be left alone to, no matter how high the level of sugar in their blood is. So there's a reason. The reason is to avoid these complications. If the sugar level in the blood keeps increasing, there is bound to be some complications. Some of these complications are even very dangerous and life-threatening. Earlier, I've mentioned something like diabetic ketoacidosis, which is one of the most dangerous complications of diabetes mellitus. There is what we call non-ketotic hyposmolar state also. Say that you have diabetic ketoacidosis or non-ketotic hyposmolar state. Very dangerous, that can lead to severe dehydration, coma, and even death. So I'm just coming from the most dangerous, maybe to the other smaller complications like the diabetic retinopathy, diabetic neuropathy, diabetic nephropathy. I will explain. Diabetic nephropathy is the destruction or the destruction of the nerves of the body due to high blood sugar. Diabetic retinopathy is due to high blood sugar, the eyesight is affected. Diabetic nephropathy is the kidney being affected due to high blood sugar. So nephropathy has to do with the kidney, neuropathy has to do with the nerves, and retinopathy has to do with the eyes, the eyesight. We also have several other complications of diabetes mellitus. We have diabetic foot ulcer, because one of the aspects of management of diabetes is diabetic foot care that ensures that any diabetic person doesn't easily sustain injuries, especially on the feet. Such injuries, if care is not taken, might develop into diabetic foot ulcer, which on its own is another great complication of diabetes mellitus. Then other complications, diabetes, if it's persistent, the person might also develop high blood pressure, that is hypertension. The person might develop cerebrovascular accident, that is like stroke, heart attack, and so on and so forth. So as you can see, we have having high level of sugar in the blood has repercussions, and these repercussions are not something that any person would want to experience.
Yeah, from what we had from Pharmacist Donatus, you all can see that the list of diseases or comorbid conditions emanating from diabetes are just endless. But there are two that I would like to highlight on that are quite popular in our community, and people don't understand it because they think, how will I put it? They think someone is trying to do a diabolical something on them. When it comes to the retinopathy one, when someone that is diabetic suddenly go blind. In our community today, some people think that is a spiritual attack. And sometimes when someone with diabetics have injury and start having diabetic foot ulcer and stuff like that, we gave it, I think it goes by the name Achire now. So we've had it that most of these conditions are medical conditions. emanating from poor management of diabetes, please, you guys will not know better than when a diabetes patient go blind, what happens, and when they have wound in their legs, and that is a diabetic foot ulcer and not arterial. Please seek for medical attention. And the last question we'll be dealing with today is there any, it's actually linking to the last one, the complications or the consequences of non-compliance, when someone just wake up one morning and say, my pastor say I'm healed, or this vendor down the street say this shot of mixture is okay to cure my diabetes if I take it for 1 month, and they just fling their medication to the bin or suspend them. So what do you have to say about the consequences of intentionally stopping your medications?
The first thing to say here is that most of that is due to ignorance. The first thing is to let the people who have been diagnosed of diabetes to understand that it is a lifelong situation that has to be managed for the rest of the person's life. They will have to understand also that there is need for proper diagnosis before declaring somebody a diabetic, because sometimes people are diagnosed even on the street and even in their houses. Any change, check, blood sugar check that is seen to be, some people will even do a random blood sugar check when they have already eaten, and they interpret it as diabetic, and they will declare the person a diabetic. What I want to use this opportunity to say is that everybody must visit a medical doctor in a hospital to be diagnosed of diabetes, because there are so many questions they need to ask, so many things they need to check, so many things they need to rule out before they can arrive at that conclusion that one is diabetic to start with. I've seen someone who has gone to a roadside store to be declared a diabetic. When we checked, we saw that the person just did a random blood sugar test, which was interpreted as fasting blood sugar test. And that brings me to the diagnosis proper. Is either the person does a fasting blood sugar test, or a random blood sugar test, or glycated hemoglobin test, or oral glucose tolerance test. Whichever the case, the person should be mindful that this will be done under supervision of a medical practitioner who will now rule out some other things before diagnosing diabetes. But once diagnosed, everybody must understand that the management is a lifelong situation. But I always advocate that any person who has been diagnosed of diabetes and who for any reason or another is not taking medication must do one thing that is extremely very important, which is constant checks. What matters is checking your sugar level on a regular basis. So even if that person tells you, if you take so and so, your diabetes is gone for life, you are not going to have it. Okay, even if you decide to take it, after taking it, what matters from then henceforth is checking your sugar level regularly to actually see that through it is no longer high. Because some people don't check anymore. They fling away the medications and stop checking the diabetes. By the time they might return to check again, it might be excessively very high. So what matters is checks. Even those that have not been diagnosed of diabetes, it is advisable that as an adult, every adult must check his or her sugar level from time to time, because the earlier diabetes is discovered, if at all, the earlier it is found out, the better for the individual, especially those who are at high risk. We have not even gone to that. People who are at high risk of having diabetes, those who are obese, those who have had a high blood sugar when they were pregnant, those who have family history, those who are from certain races and all that are at higher risk. So they need to be checking from time to time. But final word to people who are diabetic is that it's a lifelong situation. No matter what happens, check your blood sugar level regularly.
Thank you so much. So we are running out of time now. We'll just round off. Please, guys, it depends on you guys. If you want us to do a second episode of this diabetes discussion, please ask your questions under the comments on the comment section, and we'll pick it up and organize a second talk on it and answer all the questions. But quickly, I will just let you know, if we are going to do it, the very first question we will be answering, which I got from my PharmaBita platform a few days ago, are people asking about this stem cell medications or drugs that are everywhere, that people list that is cure it all. If you take it, diabetes, cancer, everything is gone. If it has got an effect on diabetes, and if you are taking it, if you are supposed to be taking your prescribed and diabetes medication. Based on the question we will get from this video, that will make us make another video, discuss that and the subsequent questions you guys will ask. But having said that, thank you guys so much for joining us. And from now onwards, you know better on how to go about your diabetes condition, look after your loved ones and all that. We appreciate having you all here. Thank you, Pharmacist Donatus, for joining us, and we look forward to doing this another day with you.
Thank you very much.
Okay. Bye, everyone.